Yeah, we don't crack anything because I won't get malpractice insurance if I crack something, so we adjust. But it's interesting, even when you said relax, that's probably my favorite word to try and get the patient to calm down when I got their neck in my hands, because it's really hard to do. That's probably adjusting everybody. It's very difficult. You know, I can push on your back, I can push on your hip, I can pull your leg, and pull your arm, but when I get to the neck and the head, people automatically have the fight or flight process of wanting to hold on. And the worst thing you can do is try to fight me, because then your muscles are all tense and then I can't manipulate the neck and adjust the spine itself, which we're trying to do. The cracking noise that you do hear, speaking of that, is a nitrous gas bubble that comes out of between bones that somehow builds up because your spine's not aligned. Okay, we're a machine. You're constantly working, like your car, you're constantly driving, working, wearing parts out. And if you're not taking care of the machine, whether it be your car, your teeth, or your back, it's going to wear out, something's going to wear out. And you're going to see that. Every time I go to Dr. Mark, he can tell me exactly what's going on in my mouth. It's kind of funny about that. He goes, oh, you chew on this side, oh, you chew on this tooth. You know, as a professional, you can point out to the patient, you know, where their problem is, and they can sometimes maybe correct it or counter that problem, and or, you know, try to stabilize it. I'm a corrective care doctor versus a pain relief doctor. Everyone sees me in the beginning for pain, but once they get out of pain, which is the goal, hopefully they don't, they're in the wrong place, we put them into a wellness or a maintenance program, which most of you that come see me are in. It's something just to maintain your body. We'll get into that in a second. Anyway, so welcome to Harbour Health Center, Chiropractic Care and Massage, my new office over here on Algonquin in Huntington Beach. It's at the Huntington Harbour Mall. It's 1.3 miles from my old office. If you guys know where I was at there, I was over by the St. Bonaventure Church over on Springdale and Highland. If you maintain your westbound car on Highland for 1.3 miles, you'll come to Algonquin. Make a left, pull into the mall, you're going to see Trader Joe's. That's the first big major store that's right there. It's in big red letters. You can't miss it, I don't think. Pull in there and you park. You can park in front, you can park in back. When you walk in straight towards Trader Joe's, and you look across the street from Trader Joe's, or the aisle, I should say, is my office, Huntington Harbour Health Center.
It says at Warner.
It's on, what's that?
It says at Warner.
At Warner. You can come two different ways, from Warner or from Highland. I'm on Highland already, so I try to tell people, if you know where I went at already, just keep continuing. If you're coming from another direction, you can take Warner, make a right on Algonquin. I'm between Warner and Highland on Algonquin. So depending on which way you're coming from, either a left off of Highland or a right off of Warner. Change is difficult for people, even though it's 1.3 miles, it's 3.5 minutes. People go, oh my gosh, you're moving way over there. That's like us locals trying to go above the 405 freeway, or the 22, no one goes that way. Anyway, it's a great office. I joined the co-op office. There's multiple doctors there, acupuncturists, massage therapists, neurotherapists, fully staffed, and it makes the office a lot more energetic when you have numerous people in the building. And it's cool because there's a lot of patients that come in. We're constantly busy. In fact, it's gotten to the point now, because I went from paper, I used to write everything, to electronic now on the computer. When the patients come in, they get a little freaked out. They're like, "What? I have to push this kiosk and decide what's a lot of people don't know how to do that or aren't used to that." Then you have to fill out. Unfortunately, your very first visit, you have to fill out a little questionnaire, which takes about 5 minutes. It's very monotonous, if you ask me, but we want your history, and it's in the computer, and now we know what's going on, especially if you're an insurance or Medicare patient. If you're cash, it's a little different. You can kind of just go through the questionnaire, no, yes, low back pain, cervical pain, whatever. But when you're first moving in, or you come in, we're going to program you into a new process on the computer, which you're going to like, because I'm going to learn how to use a computer now. So
right.
It's great. Crazy. Anyway, keep your families healthy. When I started business 25 years ago, my goal was to work on children. The way I get my patients in the old days was, go out to the Orange County Fair Market, put up the screen, talk to anybody I could. Today, I no longer go out usually to events. I usually get all my business through referrals. Excuse me. BGI, that's why I'm here. I need your business, you're my salesperson, as JT would always say. So without you, you know, I do it on my own, but why not have 20 other people working for you? When you find out that someone's got an issue, hey, I know some guy that might be able to help you out. I come in and talk to them for free, there's not a problem with that. It's can I convince them or show them that they need the care? Because everybody thinks they're okay until they're not okay. So that's my goal, to see families. And also today's July 8th, not the 7th, just in case you know, we're a day ahead. I got the date wrong here, so. No one knows. Okay, how do Okay, I apologize for the boring presentation because I've been moving for the last 30 days, so I've been kind of putting things together real quick. I'll just go through this really quickly without boring everybody. Our principles are obviously to remove the interference, the subluxation from the spine. That's what we talked about with adjusting to get your body back to normal again. Okay, feel it 100% as much as you can through the manipulation. We restore the structure and the balance and increase the function to the body. That's our goal when you get adjusted, is to increase the function. The structure determines your function. Your function determines how healthy you are. Okay? It increases the CNS, the central nervous system, your spinal cord. Okay, that's very important to have. As we get older, we get a little bit of stenosis, which means closing of the spine. People start having not phantom pain, but pain in other parts of the body that aren't very comfortable. There's not much you can do about that. Movement is good. Sedentary is bad. Okay? I don't care how old you are, because as we get older, we need more movement. We remove the pain symptoms through the adjustment. We increase sleeping patterns and reduce the stress. You get more stamina and reduce sick time. Patients, or when we used to do employee things, the employers love that, because if we convince the employer, look, if we keep your patients adjusted, or your employees adjusted and healthy, they're not going to call in sick, you're going to save some time on there. So we got the opposite side. The safety pin theory is what I really want to talk about today, but I don't have time to do the diagram. Really quick, just think about a safety pin. This is how the body works circuit-wise. Top of the safety pin is your head, it's your brain, okay? It sends a signal, a motor signal, down to the bottom of the safety pin where it swivels. That line coming down from the head to the body is a motor nerve that we want to keep connected. As the body receives the signal, it goes back up to the brain on the other side of the safety pin through a sensory nerve. So it's the brain's telling the body what to do, the body's telling the brain what's happening, okay? When you open up the safety pin, you unclick it, it opens up, it's now not connected. That's what we call a subluxation. There's something on either side of that signal that's not working properly. You're still working, but you're working on a dimmer switch. Our job is to adjust that safety pin to close that back into its position so the circuit can work normally. Does that kind of make sense? Yeah. It's kind of cool when you see it, but unfortunately I'm not an artist, I couldn't do that, I don't know how to do that stuff yet. That's the safety pin theory. That's how basically your body works signal-wise, above, down, inside out. The brain sends a signal, the body receives it, it goes back. If there's a disconnect there's something going on, or you're not working at your optimal levels. If your car is supposed to get 25 miles a gallon and now it's getting 14, are you okay with that? You know, I don't know, I'm not me. So, get a tune in. All right. I really like this page. 10 minutes about chiropractic care. They're not real doctors. We do the same amount of time until you graduate and go into your specialty. Okay. Dr. Mark does incredible CE hours. How many? 4,500 you said? I think I looked mine up the other day. I don't think even half of that.
Every year it grows.
Yeah, every year you got to do like 24 hours. At least for me, I don't know how many you do, but we have to do 24 hours of schooling. It only helps children. It only helps adults, not children. That's not true. That's why I want to see families, because when you start them young, they're a lot better off than seeing someone who's had a problem over 40, 50 years. Chiropractic treat back pain only, which is not true. Any kind of a joint you have in your body, you can adjust. It's too expensive. It's the least expensive health care you can buy. Okay? Look at your health insurance, and find out how much that costs. And then, today, unfortunately, with HMOs and PPOs and everything else, and Kaiser and all that, they're trying to regulate you and say, oh, you don't need this kind of care. But if I had knee back surgery for $25,000, they'll approve. They won't approve corrective care, or what we call elective care. Spinal adjustments hurt. I don't think you guys can all get adjusted on that. That's not true. That's what causes a stroke. 1 out of 5 million. You can stroke somebody's artery right here with a cervical adjustment, and you can stroke them out. The chance of that happening are like I said, 1 in 5 million. You say you're going to get hit by lightning first or win the lotto before that happens. So if you get hit by lightning, they can't help you. If you win the lottery, remember your chiropractor. It's harmful and dangerous, it's just a health trend, well, whatever you want to think, how you want to stay healthy, it's up to you, okay? No scientific proof it works. That's always been a battle with the medical doctors, like, oh, you don't have any science, we have a ton of scientific proof. The only proof I need is if Kathy comes in with back pain and I adjust her and she gets better and she's happy next week, that's proof that something's going on. Okay, I don't care if you have theory down or not, it works, okay? They say it heals everything, which is not true. If you go to the chiropractor and says, I'll heal this, I'll heal that, run, okay? He's not a musician, he can do that. All right. So there we go. If you can spell out Walkman without looking, I'll give you a free pillow today. Now, this is me. My new address, believe it or not, it's kind of funny, 16831 and a half. Where do you get a half at? That's my address, a half. I don't even put the half in there because when people are looking around, they're like, where's that? My name's not on the window, but the Harbour Health Center is. It says massage and chiropractic. You can't miss it. Again, if you're looking up Trader Joe's door, that's me. Our website, my email, my phone number. I appreciate all your business and your attention. Is there any questions? Okay, so Cindy's holding up a back pillow, which we're going to raffle off today. That's a lumbar support. That's good to have sometimes in your chair because you're sitting all day and you get lazy and you start going forward, and this helps you sit in the right spot. Remember, your structure determines your function. So I appreciate your time. Thank you very much. I'm Jeff Salo and I got your back.